My name is Miranda Stevens, and this is my portfolio presentation video for the Dementia Understanding the Journey final project. I just ask everybody watching this to bear with me because this is my first video presentation and I'm also at work. um, so for my project, I did a portfolio and everything is in this binder. And this is the introduction to my project. Many people who have had no formal training or information session often consider behavior of dementia and Alzheimer's clients to be challenging. There is often an assumption that the client or clients are showing an aggression or agitation because they are being disrespectful or difficult. The reality is that most of these clients showing challenging behavior are actually showing what is called responsive behavior because they either don't know how or are no longer able to voice a need or concern that they have. Often the behaviors that seem challenging are a response to physical conditions of the client, the environment the client is in, or social relations the client is experiencing. That is where the healthcare staff and the care team comes in. The care team would be the healthcare professionals taking care of the client, and friends or family or anybody who takes care of the client. Where we come into play is that we use various tools to observe the behavior, monitor it, and then go through some steps to figure out what the need is for why they're demonstrating this behavior. So I chose this topic in this format because it's kind of like a guidance package to help those who, for whatever reason, don't have the time or any reason why they can't take on an extra information session or some kind of education format to learn about these types of things. I figured maybe someday this is something I'd like to do, is make some kind of like guidance manual to help the family of the clients that I may be taking care of someday. Also, it's because the topic is one that's personally affected me, and as I've mentioned, I feel people could benefit from having a little guide reference to look at and make things easier when they're trying to figure out the needs of the dementia patient. And I also found once you have a better understanding of the behavior, feeling empathetic and practicing patience when you're in difficult behavioral situations comes a lot easier. The majority of the focus will be on challenging behavior, which we learned the better term that isn't stigmatizing is responsive behavior, because it is a responsive behavior. It's a response to whatever stimulus has triggered the need for anything. It could be pacing because they need another activity, anything like that. The personal views on why I chose this project stem from my previous experience in mid-adolescence with dementia, being a part of a family that had an elder who had dementia, and it was pretty progressed by the time that I got to know the lady, but I feel that had I known what I know now, or had access to this type of course, or even this type of portfolio guidance manual, it would have made things just a lot simpler, well, not even simpler, just easier on everybody. And everybody would have had a much better understanding that instead of trying to be rude, it was actually a response to something that the person needed. I also chose this because I've worked and volunteered in nursing homes and assisted living homes as a teenager, and a lot of the time I didn't have this kind of access to a guidance manual for anything like this, even though I was filling in for the people that did this type of work daily. So basically, this is the section that stood out most to me. So I have the next thing after the introduction is I don't know if you can see it, about the responsive behavior. So in our course, we learn that all behavior has meaning, and it is likely in response to some kind of stimuli or stimulation. It's usually not actually a symptom of the condition. The reason why they can't respond the way somebody without dementia would is because of the condition, but usually the behavior isn't just directly a symptom of Alzheimer's, dementia, anything like that. It's usually because they need something and they can't voice that. So, with that, basically the title of responsive behavior wants us to take into consideration that a client with dementia can have many different responsive behaviors, from the ones that people call challenging, like frustration, anger, anxiety, confusion, and also good or positive behaviors like joy and excitement. We focus on in this mostly the challenging side of that. It also wants you to consider that there are triggers to the behavior, and it shouldn't be assumed that it's something internal with like a disease or whatever. And that the problems causing the behavior can often be addressed in a way that can help the client communicate and change the whatever stimulation is affecting the client. So in order to help the client and determine what we should do to address the situation, we need to take into account that this is where a person or client-centered care approach is needed. We learn that this is often the place where we put into action, avoiding language that is stigmatizing or anything that's demeaning or can make the client feel threatened. We must also learn to distinguish that the client's personality and their responsive behavior are two different things. And when you get to know your client, distinguishing between the two becomes much easier. So to help deal with whatever needs the client has, we often use tools for this. So on the next pages, I have used a couple of blogs found in the Dementia Understanding the Journey textbook manual, and which have been cited on the backs of these pages. The first one is pretty straightforward. It's a care log. If you get to look at the copy of the portfolio that I've sent, then you'll get a better view of these. So the first one is pretty simple. It has a page for basically each responsive behavior. So it asks for like the name, the room, the date, all that stuff. The behavior of the client. So what behavior was observed to be specific, when it happened, where it happened, who was present, what were the other people doing, why, what else was going on around this person that could have triggered it, and how did the others and the client respond or react. The next one is basically for more than one behavior. It has some spots where you can fill in your own actions that the client may be doing. It gives you 3 on there, like sleeping in a bed, sleeping in a chair, awake and calm. Then you could add in for like number 4, pacing, and so on. It has multiple columns for different things that basically it's up to you to decide, or your facility to decide what should be recorded there. This one was also from the appendix of session 6 and then manual. And then it's got like the date on the slide so that you can record everything like that. The next tools we use are something we were taught about in the course as well, and it's the acronym PIECES, which is a trademark, and the U First Wheel, which is also registered. I feel like they're something that is being taught to be used in care facilities, but I feel like this is something that could benefit people at home. The acronym PIECES, which can both of these can be found on u-first.ca. They're used to identify the causes of behavior, the factors that can be of influence to the behavior, and the resources that may be available or suggestions for a particular situation. So pieces, the P is physical. So I want you to consider the physical conditions of the person portraying the responsive behavior. This can include many different factors like discomfort or hunger. The I in pieces is for intellectual. This is like the memory, cognition, communication, thinking, other functions that may have been impaired by the disease. The E is for emotional. This takes into account the client's emotional stability and well-being. This can also be affected by a large number of factors. Someone with normal brain function or the average person, such as